Hello everyone, welcome to my another video. Today we discuss about most important MCQ for upcoming NORCET 2023. This is part 7. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 61. A client who had surgery 24 hours ago reports pain in the cuff. Assessment reveals redness and swelling at the site of discomfort. What should the nurse do? Option A. Keep both legs dependent. B. Notify the healthcare provider. C. Apply a warm sock to the cuff. D. Administer the prescribed analgesic. Right answer is option B. Notify the healthcare provider. The clinical findings indicate a possible thrombophlebitis. Bed rest with the legs elevated should be maintained and the healthcare provider notified immediately. A thrombus may progress to a pulmonary embolus. The legs should be kept elevated until the client is evaluated by the healthcare provider. The application of warm socks is a dependent function of the nurse that requires a healthcare provider's order. Next question. A nurse inspects a 2-day-old intravenous site and identifies erythema, warmth, and mild edema. The client reports tenderness when the area is palpated. What should the nurse do first? Option A. Irrigate the IV tubing. B. Discontinue the infusion. C. Slow the rate of infusion. D. Obtain a prescription for an analgesic. Right answer is option B. Discontinue the infusion. The clinical findings indicate the presence of inflammation. The intravenous catheter should be removed to prevent the development of thrombophlebitis. Irrigate the IV tubing and slow the rate of infusion is unsafe. It may further irrigate the vein and precipitate a thrombophlebitis. An analgesic may relieve the discomfort, but it is not an intervention that will resolve the problem. Next question. A nurse is caring for a client with a diagnosis of cancer of the prostate. Which serum level should the nurse monitor to follow the course of the disease? Option A. Serum creatinine. B. Blood urea nitrogen. C. Non-protein nitrogen. D. Prostate specific antigen. Right answer is option D. Prostate specific antigen. The prostate specific antigen is an indication of cancer of the prostate. The higher the level, the greater the tumor burden. Increased creatinine levels and blood urea nitrogen levels may be caused by impaired renal function as a result of blockage by an enlarged prostate, but do not indicate that metastasis has occurred. Next question. During the postoperative period after surgery for a kidney transplant, the client's creatinine level is 3.1 mg per dl. What should the nurse do first in response to this laboratory result? Option A. Notify the healthcare provider. B. Check the intravenous infusion. C. Obtain current blood test results. D. Assess for decreased urine output. Right answer is option D. Assess for decreased urine output. The expected serum creatinine range is 0.5 to 1.2 mg per dl. The nurse should obtain additional information that may indicate acute rejection. Therefore, the nurse must first assessed for decreased urine output and changes in vital signs. Once additional data are collected, for example urine output, current blood test reports, and the IV infusions are checked, the nurse should contact the healthcare provider, explain the situation, and implement further orders. Eventually, the nurse should ensure that proper infusion rates along with IV medications are being maintained after the client is first assessed for decreased urine output and for changes in vital signs. Current blood test reports should be obtained after the client is assessed for decreased urine output and changes in vital signs. Next question. When receiving hemodialysis, the complication of the removal of too much sodium may occur, for which clinical finding associated with hyponatremia should the nurse assess the client. Option A, swastik sign, muscle cramps, C, cardiac dysrhythmias, D, increased temperature. Right answer is option B, muscle cramps. Sodium is the most abundant cation in the extracellular fluid and functions as a part of sodium-potassium pump. In the presence of a deficit, the client will exhibit confusion, lethargy, headache, and muscle cramps. Cardiac dysrhythmias are associated with increase or decrease in potassium and calcium. An increase in body temperature reflects a possible infection, not an electrolyte imbalance. Next question. Blackwater fever occurs in some clients with malaria. For which response should the nurse assess this client? Option A, dark red urine, B, low grade fever, C, clay colored diarrhea, D, coffee ground emesis. Right answer is option A, dark red urine. Plasmodium falciparum in persons who have chronic malaria can cause hemoglobinuria, intravascular hemolysis, and a renal failure as a result of destruction of RBCs. Next question. Which drug does a nurse anticipate may be prescribed to produce diuresis and inhibit formation of aqueous humor for a client with glaucoma? Option A, chlorothiazide, B, acetazolamide, option C, bendroflumethiazide, D, dimethylcerium bromide. Right answer is option B, acetazolamide. Acetazolamide is a carbonic anhydrase inhibitor that decreases inflow of aqueous humor and controls intraocular pressure in acute angle closure glaucoma attack. Next question. What should the nurse monitor to evaluate the effectiveness of carbamazepine in the management of a client's trigeminal neuralgia? Option A, pain intensity, B, liver function, C, cardiac output, D, seizure activity. Right answer is option A, pain intensity. Carbamazepine is administered to control pain by reducing transmission of nerve impulses in clients with trigeminal neuralgia. Liver function is monitored to detect adverse reactions to carbamazepine, not to determine therapeutic effectiveness. Carbamazepine is not given to influence cardiac output. Also, it is not administered to clients with trigeminal neuralgia for its anticonvulsant properties because seizures are not present with this disorder. Next question. Syphilis is not considered contagious in the dash stage. Option A, tertiary stage, B, primary stage, C, secondary stage, D, incubation stage. Right answer is option A, tertiary stage. The tertiary stage is non-contagious. Tertiary lesions contain only small numbers of treponemes. The primary stage lasts 8 to 12 weeks. The country is teeming with spirochetes and the individual is contagious. The duration of the secondary stage is variable, about 5 years. Skin and mucosal lesions contain spirochetes and the individual is also highly contagious. The incubation stage lasts 2 to 6 weeks. Spirochetes proliferate at the entry site and the individual is contagious in this stage. Next question. A client is diagnosed with herpes genitalis. What should the nurse do to prevent cross-contamination? Option A, institute droplet precautions. B, arrange transfer to a private room. C, wear a gown and gloves when giving direct care. D, close the door and wear a mask when in the room. Right answer is option C, wear a gown and gloves when giving direct care. The exudate from herpes virus type 2 is highly contagious. Gown and gloves should be worn. A face shield should be worn if there is potential for splashing of body fluids. The organism is not in respiratory tract secretions. The organism is present in the exudate from active lesions. So we should not institute droplet precautions. And arrange transfer to a private room is unnecessary. Close the door and wear a mask when in the room is not necessary because it is not an airborne infectious disease. So this is the today's video. Thank you so much for watching my video.